Molweni, siyanamkela kuSiyayinqoba Bidit, inkqubo yokwenza uthethe ngempilo yakho ukusuka kwezesondo uya kwiziyobisi, kwezokutya nendlela yokuziphatha. UBidit unqala ngqo kwimicimbi ebalulekileyo yezempilo kwilizwe lethu. Ndingnokubonga yawa, ndiphila ne-HIV. Kule minyaka imbalwa idlulileyo, kubekho amanani othusayo engxelo zokubhubha kwabantwana kwi-neonatal wards kwizwe jikelele. Ziye zakhona nezinye ingxelo zokusweleka kwentsana ngenxa yedrip ezifumene intsholongwane. Usuleleko yingxaki yomhlaba jikelele yaye intsana zisemngciphekweni. Olu suleleko lwe-neonatal lolwesithandathu ngobukhulu ekubhubheni kwentsana. Lunenxaxheba enkulu apha eMzantsi Afrika, loo nto yenza ukuba amanani onyuke ukusuka kwintsana eziyi-60 ukuya kwezi-100.
Groote Schuur yaziwa as the Center of Excellence for Infection Control. Size apha namhlanje ukubona ukuba infection control kumele uba yenziwe kanjani.
Can you tell us a bit about what infection control is?
Well, there's always going to be infection around us. So our emphasis is on prevention and control of transmission of infection. And so we have policies in place. We teach and we provide a clean and a safe environment as far as reasonably possible for all our staff, for our patients and our visitors on our premises.
Could you provide some basic or general examples of infection control?
When we identify patients with TB, chickenpox or measles, we preferably put them into a side room because our side rooms are fitted with extractor fans. So the air comes in and it gets extracted out, so there's 6 to 8 air changes per hour in this room. There's a switch that gets switched on. There's the door and the window that gets kept closed, and the signage is put on the door so that it alerts everybody that comes to this patient, and the door is kept closed. So it alerts everybody that they've got to keep the door closed, that they've got to wear a special mask when they come into this room, that they wash their hands before they leave the room after they've done whatever procedure. We also use the droplet precautions with our patients who are immunocompromised so that we don't take infection to them. And then we have contact precautions where we use gloves and aprons, etc., with patients who we identify that have germs or organisms, as you might call them, that could spread from patient to patient or patient to staff or patient to the environment.
Now, in hospitals like this one, like huge hospitals, are there different departments? And in those different departments, do you practice different kinds of infection control precautions?
The precautions that we put in place would be at a different level. Like, for instance, in your general wards, there would be contact, airborne and droplet. You go into a theatre environment, you need to change clothing and you need to have a special policy for theatres. You go into our isolation intensive care units where we nurse patients who are compromised, and then where we nurse patients who are infectious as well. This is our sharps container, so our needles and syringes, once you've given an injection or you've used a needle and syringe, you dispose of it into here. When it's almost full, the housekeeping staff will seal it, take it down and exchange it for a new one. This is where we will dispose of our waste. Okay. We set the clear bag, goes to the municipal dump site. The red line bin goes with our medical waste company that's contracted to the institution. They'll take our medical waste away.